Hello, everyone. My name is Kaisa Kerrigan. I am the Community Health Coordinator for Milwaukee County Area Agency on Aging. Today, I'm sharing an overview of our 2026 LEAF Grant project, which focused on strengthening fall prevention efforts through a pharmacy referral pathway into stepping on an evidence-based falls prevention program. Our project explored a simple but powerful strategy, empowering pharmacists to identify older adults at elevated fall risk and directly refer them to fall prevention programming. Now, before discussing the intervention, it's helpful to understand why pharmacies were chosen as the central point of contact for this project. Medications are a major contributor to fall risk amongst older adults, and most of who are injured in falls were taking at least one fall risk increasing drug, often several. These can include sedatives, certain antidepressants, and antihypertensives. Pharmacists see patients frequently, have full visibility into their medication list. They see patients often more than a primary care provider sees a patient, and can identify fall risk issues early. So this is especially important in neighborhoods where many older adults rely primarily on their pharmacy for regular health engagement. Our partner in this project, Hyatt Pharmacies, serves communities with high concentrations of underserved older adults, many of whom do not regularly engage with healthcare outside of pharmacy visits. By embedding fall risk screening into the routine pharmacy operations, we were able to reach individuals who might otherwise miss preventative services entirely. Now, just a little bit of information on the Stepping On program, which many folks are probably familiar with. Stepping On is a 7-week evidence-based workshop designed for older adults at risk at falls. It combines group learning, strength and balance exercises, goes over home safety strategies, vision and medication education, and expert guest speakers. Research shows that stepping on can reduce falls by up to 31%. And this makes it one of the strongest community-based fall prevention programs available. So Milwaukee County received LEAF grant funding from WEHA to pilot a pharmacy to community referral pathway. We partnered with Hyatt Pharmacy, as I mentioned, as the screening and referral point, and the Stepping On facilitators were staff at the Greenfield Fire Department. We developed a fall risk criteria to help pharmacists identify high-risk patients. So that criteria included if the patient had a fall in the past year, reports of dizziness or unsteadiness, polypharmacy, so in this case that would be taking more than 4 medications, or use of high-risk medication groups, as I mentioned before, including sedatives, antidepressants, antihypertensives, and benzodiazepines, or any medication affecting balance. So when a patient met any of this criteria, their medical record was flagged, and the pharmacist invited them to a CMR, or a comprehensive medication review. So this is an appointment that reviews all medications, prescriptions, over-the-counter, supplements, and identifies opportunities to reduce the fall risk increasing drugs or consider safer alternatives. CMR invitations in the pharmacy often arise naturally during refill calls or pickups, which we envisioned this would make it an ideal moment to introduce the Stepping On program for those patients whose records were flagged as high risk for falling. So our referral workflow was as follows. 4 clear steps. So first, the patient is flagged as high risk using the criteria we just went over. Second, the pharmacy team recommends that the patient schedule a CMR. Then during the CMR, the pharmacist discusses the fall risk increasing medications and introduces Stepping On as a resource for preventing falls. Finally, if the patient is interested, the pharmacist would refer them, would tell the clinical director to follow up with that patient The clinical director would give that patient a phone call, tell them more about stepping on, more details about it, and if the patient said that they would be interested, then Greenfield Fire Department would follow up and enroll the patient in the workshop. To reduce transportation barriers in this project, we located the workshop very close to the participating Hyatt sites. It was within a couple miles of most of the Hyatt pharmacies. And then for home delivery patients who often have even fewer clinical touch points, referral postcards like the one you see on the screen here were attached to the prescription bags to make sure that no high-risk individual was missed. So throughout this project, we implemented a standardized pharmacist workflow across 5 Hyatt locations. Staff were trained to identify patients at elevated fall risk, initiate those conversations about fall prevention and the medications that they are on that increase their fall risk, and then refer interested patients to receive more information about the Stepping On workshop and eventually enroll in the Stepping On workshop. This increased pharmacist awareness of fall risk factors and strengthened their understanding of how medication management relates to falls. It also expanded patient awareness. Many patients presumably never considered that their medications could increase fall risk until these conversations occurred. And then additionally, this project helped to increase patients and pharmacists alike of local fall prevention resources in the community. So some lessons that we learned from this project. Many patients needed repeated exposure before committing to a program. Early on, pharmacists introduced the Stepping On during the CMR, and then our clinical director followed up only if someone expressed interest. But many declined wanting to find out more about Stepping On before that follow-up could occur. So what we learned was that more proactive outreach, like calling all eligible patients, all patients that were at an increased risk of fall, may improve future enrollment. Because of all of the patients that were offered this CMR, almost half of them declined that CMR, and it became clear to us that that fall risk conversation cannot rely solely on the CMR appointments. So as we were in the implementation phase, we discussed that conversation could happen at prescription pickups, during refill calls, home delivery interactions. Those all became essential points of engagement, and we know that sometimes people need to hear things several times before they're ready to commit to it and find out a little bit more about it each time. Reaching home delivered patients, as mentioned before, required some creative strategies like adding that postcard to prescription bags and integrating the fall risk reminders into phone call conversations when people call for their refill. We also learned that language accessibility matters. Several high-risk patients that were offered the CMR declined Stepping On simply because it was not offered in their preferred language, namely Spanish and Arabic in this project. So future expansion of pharmacy referrals, especially when working with locations such as Hyatt Pharmacy with large populations of patients with limited English proficiency, will need to take into account multilingual workshops. And finally, workflow reinforcement and staff confidence were crucial. Pharmacists needed ongoing support to consistently identify fall risk patients, to remember to be going through the workflow process, integrating this into their workflow, using the referral guide and tracking referrals accurately. Not an easy thing for them to fold in something that they're not accustomed to having in their work plan into their standard work process. So that was a bit of a challenge to get that full pharmacist buy-in and ensure that the workflow that we had created was being followed. So sustainability and next steps. Stepping On remains free. It is a program that is widely supported throughout Milwaukee County and is offered in many, many locations throughout the year. That includes healthcare facilities and community-based organizations and sites as well. So this supports long-term sustainability. Additionally, Hyatt Pharmacy plans to continue using the fall risk screening and referral guide, and Milwaukee County Area Agency on Aging will keep promoting workshops and will begin sharing quarterly workshop updates and a schedule of stepping on workshops that are located near Hyatt facilities and throughout Milwaukee County with Hyatt Pharmacy staff. So thank you so much for the opportunity to share our project. We learned a great deal about building a pharmacy-driven referral pathway, and really do hope that these insights help others planning to apply for the LEAF grant funding. Best of luck.